This is a correlative study that we did in relapsed refractory mantle cell lymphoma trial that was carried out by the Nordic Lymphoma Group Mantle Cell Working Group in the Nordic countries. In this trial, which was a phase 1b/2 trial, the MCL working group studied the efficacy of Lenalidomide, Venetoclax and Rituximab in relapsed refractory mantle cell lymphoma. And these are patients who need new therapies, their outcomes are poor, and luckily there are a number of options for these patients, and this was the combination that was studied in this particular phase 2 trial. And I would like to point out two things from this trial. First, this trial observed an overall response rate of 63% in these 59 patients that were included. And then the other factor about this particular study was that it was studying how we could do MRD-guided treatment decisions in clinical practice. So this trial, during therapy with this combination, the patients were tested for MRD with an RQ-PCR test from the bone marrow and the peripheral blood. And if these were negative and the patient was in clinical response, they were allowed to stop the treatment. Now, coming back to our study with the enhanced ctDNA platform that we have established in our laboratory in Helsinki, we applied this platform now to samples drawn from these patients. So we had a lot of pre-therapy samples from bone marrow, peripheral blood, and lymph nodes, which involve the disease, and of course the cell-free DNA or plasma samples that we use to study ctDNA. So what we found through our study, we set out to answer who are the patients who benefit from this treatment or respond to this treatment and who don't. That was first part of the study where we identified that a certain genetic aberration, that is a TP53 mutation, associated with very low response rate and poor survival of the patients. So the TP53 mutated patients did not benefit from this therapy. Next, we expanded our analysis to the ctDNA level. So we genetically interrogated the ctDNA in the plasma samples prior therapy, and when we quantified the ctDNA levels, we could see that the ctDNA concentration, which is very well established in many other B-cell malignancies, correlated with multiple clinical parameters that are associated with high-risk mantle cell lymphoma, and also with the survival in accordance that patients who had high ctDNA levels had also poor outcomes. And to our surprise, this was independent of the TP53 mutation status. So analyzing ctDNA really brought something else to the picture. And with this trial design, which was MRD guided, we had the unique opportunity to also analyze in patients who responded their 6-month samples that the patients were on therapy with our combination for 6 months, and we could ask, could we detect remnants of ctDNA in these samples? And here also we learned that through ctDNA analysis, we can observe and quantify treatment responses in this particular disease too, with the help of our platform and ctDNA.